Assalamu alaikum everyone. So today I will discuss about the leukemia. Because some people they were asking me that it is really difficult to remember all the leukemia feature and differentiating them and about the prognostic factor, how to easily remembering them. Okay, so what I'm doing, I'm trying to do, I think, the most simple way to remember all the leukemic together. I'm trying to make tables with them. So that's how I remember myself. So I hope that it will help you guys also. Okay. So come with the now if you see I'm doing all the tables like CML, CLL, here AML and ALL. Okay. So how you will differentiate from the picture, from your scenario, how you will differentiating them. So in case of CML, you will get the granulocyte different stage of maturation will be high. Like it could be myelocyte, promyelocyte, metamyelocyte. Okay. So all this it could be high. And also any B, I mean neutrophil, eosinophil, basophil, all this WBC count, it could be high along with thrombocytosis. It could be also with platelet high. Okay. If like that, you will think this is about CML. Got it? Now come with CLL. This is our lymphoid series problem. This is our lymphoid series, not the myeloid series. Myeloid series with this CML. Okay. But lymphoid series problem, this is the lymphocyte. So T and B lymphocyte. Which lymphocyte more affected here? B lymphocyte. So if you get in your question that B lymphocyte is getting higher, so with of course WBC high, this is, and usually in the old age, this is CLL. So if somebody in the scenario you get it like B lymphocyte high, this is the most important diagnosis that this is the CLL. Okay. This is most commonly found adult leukemia. Actually, okay. So there were some complication you can get. As you know, from B lymphocyte, we are having the plasma cell, ultimately all the immunoglobulins. So if there is problem in the B lymphocyte series, so what it will have? It will have, I mean, it cannot produce all the globulinemia. Okay. There will be like all the immunoglobulin, it would be low. It would be low. So there will be pan-hypogammaglobulinemia. If pan-hypogammaglobulinemia will be there, what our immunity system will be down, so there will be recurrent infection, and this is the common cause of death. So there was a question that was a CLL patient, and what was the common cause of death in CLL? That is our this pan-hypogammaglobulinemia. Okay. So another thing, it is one kind of warm autoimmunohemolytic anemia. When I told you about the autoimmunohemolytic anemia, that time I told you, right, that RA, SLE, CLL, these are with all warm autoimmunohemolytic anemia. This is associated with which immunoglobulin? Usually with immunoglobulin G. Usually with immunoglobulin G. This warm autoimmunohemolytic anemia. Okay. Now, again, the important thing is that it can have some transformations. So to lymphoma, that is called the Richter's transformation. This is high-grade lymphoma, usually they're transforming to. So this is known as the Richter's lymphoma. So now come, first I told the granulocyte different stages of maturation if you are finding. This is CML. If you are finding B lymphocyte high, you will think of with WBC, of course, WBC high and especially B lymphocyte high, you will think of CLL. Now come with AML and ALL. This AML, ALL, this one is associated with blast cell. So if blast cell in adult, you will think of AML. If blast cell in child, usually 2 to 5 years, then you will think of ALL. So these two about the blast cell, myeloblast. Okay, that's how you can easily diagnose them. Now, they will ask you how you can do the confirmatory diagnosis of this 4 leukemia. So 4 leukemia, all these 3 I colored it like yellow. These 3 you can go with bone marrow, cytogenetics and karyotyping. Only the CLL, the most common of adult leukemia, this one, no need of bone marrow biopsy. This one with peripheral blood, if you are doing the flow cytometry or immunophenotyping, you can get, if you are getting the CD5 1923 like that, it is that already confirmatory for our CLL. No need for bone marrow. No need for bone marrow CLL. So all these things you can go for cytogenetics or karyotyping, other three. But this one, the peripheral blood immunophenotyping or flow cytometry. Okay. So this, of course, was in question. Now, how to know? I mean, if a scenario you got a key point, one small key point is enough to diagnose any kind of CLL if they are mentioning. So just a minute. Yeah, I can summarize it, you know. So if you see that AML, I mean, or rod cell in your question, in the scenario, this is definitively AML. This is definitively AML. What is or rod cell? Or rod cell, it is like a needle-shaped inclusions that you can find in the cytoplasm. I will show you the picture. I will show you the picture now. And now come with CLL. You will see smart cell. Why? Because of these B lymphocytes are more. So whenever they are doing the peripheral blood, it is like distracting. So they are giving smudging of the B lymphocytes. So these are giving you the smart cell appearance. So it's like some destroyed artifact, okay, in your peripheral blood. So if it is a smart cell, it is CLL. If TDT positive, usually it is ALL. What is TDT? Terminal T transfers. Okay. Regarding CML, usually they are actually mentioning of this Philadelphia chromosome. So this one I didn't write here. So I wrote about this hairy cell leukemia. This is a subtype of CML. So for hairy cell leukemia, the confirmatory keyword you will get, like there is an abnormal WBC or monocyte maybe with microvilli, hair-like projection with WBC. Okay. So let me show you the picture of them. So if you can see, this one is our or rod cell. Can you say this one? This one or more or rod cell. This you say needle shaped. It is the cytoplasm. This purplish or blue, not purplish, the bluish one. It is the cytoplasm. So this or rods are in the cytoplasm, not in the nucleus. Okay. So this nucleus is the purple one, the big one, and nucleoli is the I mean this like mild purple. Okay. So this is the prominent nucleoli. Okay. So the fact is that if you get a picture like this or rods, this is definitely with our AML. Okay. This is our doll bodies. We will talk about this doll bodies later on, inshallah. This is the Licomoid reaction. Okay, so this is the smart cell. Can you see this? This is like somebody destroyed them. So when they are preparing the slide, because of this smoothing of the cell, this will show you like this. This is the smart cell which you will get in CLL. Okay. This is the hairy cell leukemia. You see the hairy cell projection is there. These are the WBCs. So this one is known as the hairy cell leukemia. This is the keyword for hairy cell leukemia. Okay. So this is the thing. So let's come again to our yeah, I think you can see already. Okay. Now, this one I told you how you will diagnose, right? How you will diagnose, it is finished. Now, come with the, if already hairy cell leukemia, the topics is there. Let's see a little bit about hairy cell leukemia in a short. So hairy cell leukemia, if in your scenario there is like pancytopenia, okay, especially monocytopenia is there, monocytes are low with large splenomegaly and cellulitis. So there was a question, the patient was having cellulitis with large splenomegaly. He was having monocytopenia. This is more like hairy cell leukemia. You will get one of this keyword in your question. If you, it's what? Dry fry trap. Dry fry trap. What is dry? If you aspirate the bone marrow, you will get the dry trap. If you do the biopsy, you will get the fried egg appearance. If you do the staining, you will get the trap staining. So dry fry trap. This is our mnemonics. Dry fry trap. Okay. This is our mnemonic. Now come, which one is important for us? Now prognostic factor. Prognostic factor is very important for part 1 and part 2 both. And it is very difficult to remember if you don't remember it in a very good way, I mean in a table. Okay. So how I am doing that? Let's make a table. So this is our CML, CLL, and always in my table, the 4 quadrant is exactly, CML is on my left upper quadrant, CLL is my right upper quadrant. Why? I'm always doing all the tables in a same sequence so that my pictorial memories will, even if I'm forgetting, I will try to remember the image. And inshallah, I will give you all these slides which I show you. So I took the picture, so I will give you those slides, inshallah, that notes. You will get it, inshallah. Okay, so don't worry, you don't have to write it down. This one, yeah, prognostic factor you have to write if you want to. Not write, just to remember. If you just see the videos and try to remember, just listen to it, it's enough, inshallah. Okay, so CML, the good one is which one? Philadelphia chromosome, right? BCR-ABL. So Philadelphia chromosome 9:22. This is good for CML and bad for the AML and ALL, right? So this is finished, that this is good only for CML. Okay. Now, okay, I had a question in chronic with CML. He only came with like only with splenomegaly. Then maybe there was something that indicated to our CML, maybe Philadelphia chromosome was there. So just I'm telling you that with sign symptom is not that much specific that you will get. Okay, so you have to go with your keywords, or you have to go the peripheral blood, the bone marrow biopsy reports, like that. So you have to know how you will differentiate. Okay. So this is the good prognosis of CML. CML finished. There is nothing to remember anything about that one. Okay. Now come with AML. AML, how you will remember? As I told you that poor prognostic factor, if you are seeing, already I told you, this is one, that Philadelphia chromosome. This is, if you are finding it, this is what? Poor prognosis, right? If the patient is 60 years, more than 60 years, this is poor prognosis. If there is more than 20% blast cell, even after chemo, I mean, it is already still there, you give the chemo and still there is like 20% blast cells are there. So this is also poor prognosis. Some deletion is there. If there is 5q or 7q chromosomal deletion, then this is poor prognostic factor. Okay. So if Philadelphia, more than 60 years, more than 20% of blood cell after chemo, 5q, 7q deletion. Okay. So here it is what? 70 years. Here it is 70 years. Now come with our CMLL. This one, why I'm telling you, this one with that one 60, sorry, that one 60 years. Now CLL, poor prognostic, you will go with 70 years. I will tell you why I will tell you a interesting story, okay, to remember this. How? one 70 years old man, he fell in love with a young woman of 38 years. A 70 years old man fell in love with a 38 years old woman. Okay? So, why I'm telling you this? If more than 70 years, this is a poor prognosis. If LDH receptor expression more, this is poor prognosis. If CD38 is there, it is poor prognosis. Finish 3. Come with another 3. Lymphocyte related. What are those? If lymphocyte count is high, maybe more than 50, it is 1. Number 2, if pro-lymphocyte count, if it is more than 10%, this is also bad. If lymphocyte doubling in a very short time, they are telling less than 12 months, this is 6 months in B symptoms. B symptoms. As we know, there is a B symptoms, right? Like weight, then fever, fatigue, and this. So weight and what that one? Sweat, right? Sweating. So those B symptom, the doubling period is less than 6 months, but here the doubling period is less than 12 months. So this 3 you can remember associated with lymphocyte, okay? So some other things are there that if you are solving the question, you will get them. You know, unlucky 13. So if unlucky 13, so if it is deleted, that is good, right? Because they are unlucky. So it is the good prognosis. Unlucky 13 is the deletion of unlucky 13 is good prognosis. So 17, in other words, if 17 deletion, this is poor prognosis. So 17 and 13, remember, this is the lucky one, this is the unlucky one. Okay. Another thing is that TP53, this is also poor prognosis. TP53 mutation. This one you will get a question. So I think if something is in the question, you will never forget. Okay. So this was in our past medicine actually, but I had a question also in past test. There they told that even beta-2 microgroup, especially this question, you need to remember why. They have options age. Sorry, yeah, male sex. Male sex also, I mean, this is a poor prognostic factor. Also, they told beta-2 microglobulin more than 3.5. Both they mentioned in that question, but they wanted us to choose this beta-2 microglobulin. Why? They told this beta-2 microglobulin having more effect than only the male sex, Okay, so it is important if it is there, that beta-2 microglobulin level is high. Even some other options are there. I mean, indication is there, like renal failure. If you have to, that is also poor prognostic. But I think it is enough if you can remember these things at least. Okay, so this is about our CLL. Okay, now come with our ALL. ALL having so many good and poor. So I will show you my notes with ALL. So this one also I have a mnemonic. I have a mnemonic to remember. What is the mnemonic? See the mnemonic. ABC fav deal. ABC favorite deal. ABC favorite deal. Okay. ABC favorite deal. So what is ABC favorite deal? Say. Yeah. So this A, B, C favorite deal. What is A? What is A means? Good prognosis, all common ALL. Uncommon ALL, this is poor prognosis. And already you know that this Philadelphia chromosome, this is uncommon. This is common in only of CML. So in case of ALL, this is poor. So other than that, all common ALL is having good prognosis. And there is a very interesting factor in case of good prognostic factor of ALL. Most of the feature is like mirror image. Mirror image. Why I'm telling you, see, look at this 1, 2 to 1. 1, 2 to 1. This is like a mirror image. Okay. So this is if you find in ALL, if it is a, because these are in the children. So children, when they're looking at the mirror, they're getting happy, they're feeling good. Okay. So if you find mirror image in case of ALL, this is a good prognosis. This is a good prognosis. Like here, I'm telling you 1, 2 to 1. This is a mirror image in case of ALL. So it will be a good prognosis. Okay. Now come with B. B for, remember B phenotype, this is the good one. T or B cell surface markers, this is the poor prognostic factor. Okay, so this is about your B. Now come with C. What is C? WBC. What is C? WBC. If initial WBC count is low, this is good prognosis. If it is high, that is poor prognosis.